Welcome, everybody. My name is Maria Restrepo Toro, and I am the New England Mental Health TTC co-director and also the chair of the Cultural Responsiveness Working Group. We welcome you in behalf of our group to this fabulous conversation today, our fourth conversation of the series. Today, we're here to talk about motivational interviewing. Before we jump into the process, I'm going to remind you of a few housekeeping items. Next slide. For today's presentation that's being recorded, please, all the participants are going to be muted. So if you have any questions to the presenters, please use the Q&A pod. And the co-chair of the Cultural Responsiveness Working Group is going to be monitoring the chat, and we are going to make sure to respond every single question here today. In following this presentation, you will be receiving a certificate of attendance, and you will also receive the slides. And we're going to be, if for any reason there are additional questions, we'll be cover all of those. Next slide. For today's presentation, we're going to be using polls everywhere. So if you haven't done so yet, the way that it's going to be an interactive conversation, we want you to go to the website listed on the screen and download it in your desktop or in your application and enter the prompt on the screen and the text. And all of the communications are going to be, and the chats that the presenter will do are going to be using poll everywhere. If this is your first time joining us, welcome to the Mental Health TTC Network. Let me tell you a little bit about, in the next slide, what the Mental Health TTC Network is. We are funded centers that seek to really accelerate the adoption and the implementation of mental health practices. We are here throughout the entire country to help different regions disseminate resources, provide free local training and technical assistance, and to really increase the awareness, knowledge, and skills of the mental health force. Next slide, you will see a map where all the mental health TTCs are listed. Every single region has a mental health TTC. As I said initially, I come from the New England Mental Health TTC. And then there are two amazing national centers, the Latino Hispanic Mental Health TTC, as well as the Native American Mental Health TTC. So you will see those, and you can access for additional information on our network. Just next slide. Everything we do, clearly our disclaimer, this is prepared for the Mental Health TTC Network and this agreement that we have with SAMHSA. And all these materials at this time of the presentation, we acknowledge that Tom Kadir is serving as the SAMHSA Assistant Secretary, and the opinions expressed here, either the views of the panelists or the presenters, are not the positions, do not reflect the position of SAMHSA. And next slide. Very important for our network, the Mental Health TTC Technology Transfer Center collects information, and we do that to what we call GRIPRA. We are here funded to serve all your communities, but it's extremely important that you actually tell us how we are doing with the different presentations. So after this training, you're going to see a link that's going to appear on the screen and a code. And here you will complete a very brief survey. It's only 2 minutes. And we ask you to please complete this GRIPRA link. This conversation, as I said, is the 4th series of our conversations. And the conversations, which really are designed to really hear from amazing presenters and hear from you how to implement these practices, is actually a work from the Cultural Responsiveness Working Group of the Mental Health TTC Network. Next slide. This group is composed with, sorry, we jumped to the slide, I'm sorry. Yes, this is a very important slide, and we invite everybody, and we want to acknowledge that the Mental Health TTC Technology Transfer Centers, we use affirming and respectful and recovery-oriented language. Person first language, we know inspires hope and is uplifting for people in recovery. and it is essential to respect, is inclusive, acknowledges diversity, and promotes equal opportunities. So we invite all of us today to, respect those guidelines. So in relation to the series, what I was going to describe to you is the series is being created by the amazing Cultural Responsiveness Working Group of the Mental Health Literacy Network that's comprised of many members from around the country. And we seek to really promote and disseminate appropriate information and technical assistance that is cultural responsiveness to mental health services. Through this work, initially we discovered that it's extremely important to really acknowledge and promote cultural inclusive mental health practices and community informed practices. Therefore, we have been developing the listening series sessions. Next slide. So this is our 4, and through these listening sessions, what we've been trying to do is engage all of you in a very interactive conversation so we can actually hear from you and learn from the presenters here today, the experts on these practices, and how to really include and provide evidence-based practices, and how we can also define practices based on the community. So you are here for a treat and a wonderful conversation today. So I would like to welcome you now, David Brown, my colleague from the Mental Health Literacy Network and a member of the Cultural Responsiveness Group, to introduce the presenters and moderate the rest of the section. Thank you so much.
Hello, everyone. As I shared, my name is Dave Brown. I am the Senior Associate for School-Based Training, Behavioral Health Equity for the Central East Mental Health Technology Transfer Center. And our goals for today are to engage the constituents in an interactive conversation about culturally inclusive mental health practices, including evidence-based practices and community-defined practices. To explore the strengths and barriers of community-defined practices and to elevate them to culturally and linguistically appropriate services standards. Identify ways to increase promotion of evidence-based practices and community-defined practices and technical assistance and training offered by the MHTTC's network. And today, that focus is around motivational interviewing. Next slide. Our agenda for today will be for our panelists to provide an overview of motivational interviewing, to define MI, discuss how MI may be implemented with various cultural groups, to discuss culturally responsive MI practices, discuss culturally and linguistically appropriate services standards as they pertain to MI, and really discuss the polls, our conversation starters. Examples and lessons learned during the implementation of MI, balancing MI and the cultural needs of the people served. And really to discuss fidelity considerations, and then we're going to look at the polls that we're going to ask you to complete next. And at the very end, there'll be a time for everyone for a Q&A session, and finally we'll end with our wrap-up. Next slide. Right now, we're going to ask everybody to take a poll so we can get a sense of what the group's familiarity is with motivational interviewing. And the way to access the poll is we're using a tool called Poll Everywhere. You can access Poll Everywhere by going to your computer web browser and typing in, as you'll see on the screen, POLLEV.com/NWM-HTTC. Or there's a link in the chat room which you can click on. Or you can text NWM-HTTC to 22333. If you do go to the link in your browser, if you type in the link that's on there, you'll download the app Poll Everywhere. You'll enter NWM HTTC. If you have any questions, as my instructions might have been confusing, or if they're confusing on the screen, you can certainly ask any questions in the chat room. So take a minute to answer the poll, as that will help our two panelists share with their expertise in a more targeted fashion. You can see already people have already logged in and beginning to answer the poll. On scale of 1 to 5, moderately familiar on average. We do have some people who are fairly familiar, very familiar with. Very good. Everybody another minute or two to respond, and then we'll move to the next poll question. Just more than half of our attendees who have responded so far. And I think we could continue to answer the questions even as we move on to the next slide. Good sense. We'd like to welcome our two panels. It's certainly both my pleasure and my honor to welcome our panelists. Dr. Henry Gregory is a clinical psychologist with a wealth of experience as a clinician, educator, trainer, and researcher. He currently is an assistant professor at the University of Maryland School of Nursing, where he teaches, among other subjects, motivational interviewing at the undergraduate and graduate levels. He has served as a facilitator mentor at Georgetown University's National Center for Cultural Competence, as the assistant director of the University of Maryland Baltimore County Center for Community Collaboration, and as a cultural competence coordinator at MD Cares, a SAMHSA-funded system of care. And he's from Baltimore, my hometown. I'd also like to welcome Laura Saunders, MSW, who's with the University of Wisconsin-Madison College of Engineering, Center for Health Enhancement System Studies, Great Lakes ATTC, PTTC, and MHTTC, and an independent consultant. Since 2001, Laura has designed, facilitated, and delivered MI and expert training and coaching in person, online, and via distance learning in the fields of healthcare, human services, public health, and criminal justice. She has provided feedback and coaching to hundreds of learners who are interested in using evidence-based practices to fidelity. Laura has also conducted Train the Trainer events. She joined the International Group of Motivational Interviewing Network of Trainers, MINT, in 2006, and is an active member of Wisconsin Motivational Interviewing Group. I'd like to welcome both of our panelists, and I'm thrilled to listen to them speak. And I'm going to hand it off to Laura. Thank you both for being here.
All right. Thank you, Dave. All right. Good afternoon. It looks like I am going to be talking to people who already know quite a bit about motivational interviewing, which is one of my most fun things to do, to talk to people who already know something about this, because then I get to learn some stuff from you. So I want you to keep that in mind. I want you to keep what you already know about motivational interviewing and what you already know about motivational interviewing as a culturally responsive practice in mind. Your experiences with motivational interviewing and your experiences with your culturally diverse populations that you work with are the most important thing that you can bring to this workshop today. I'm going to say some things that hopefully will generate some discussion. And then what we'll do is we'll take what I said and pair that with what you already know about MI, about the people you work with, about what the people you work with genuinely need from you in order to do their best. And so that's what we're going to talk about today. So motivational interviewing is indeed a person-centered approach. It is based very much of what MI is based in person-centeredness. And it's that person-centered part of motivational interviewing that creates the opportunity for MI to be a culturally responsive evidence-based practice. Well, it's an evidence-based practice. It's also spiritual and artful. How a person views themselves as a helper and how they regard the person who's needing the help, the client, consumer, customer, and their role in that person's change process requires us helpers to transcend any ideas we have about hierarchy or otherness. And that's what's so wonderful about motivational interviewing. So slide. I'm coming to you, like Dave said, I am coming from the Great Lakes ATTC, PTTC, and MHTTC. That's where I spend my time. Slide. So motivational interviewing asks us as helpers to do this, to not do harm. And one thing that I think is important to remember when we're talking about evidence-based practices is that us as mental health providers, as mental health and substance use disorder providers, we have an obligation to learn evidence-based practices. And we have an obligation to learn those evidence-based practices to fidelity. We expect the same thing when we're getting care. When we're getting care in the physical realm, we wouldn't be comfortable seeing a doctor, seeing someone to help us with our physical problems who treats a broken leg with an amputation. And so we deserve and expect updated practices. Our clients, the people that we work with in the mental health and substance use field, deserve that same respect. We need to stay abreast. We can't just make things up and say, oh, this is good enough. It's good enough. I use the Laura style of helping people and that's good enough. Sometimes when we do that, we are doing harm. Slide. So what we're going to talk about today is we're going to talk about the facts, just a little tiny bit about what the research evidence tells us about the cross-cultural transferability of motivational interviewing. We're going to talk about what motivational interviewing is. It looks like the bulk of people who are attending today know what motivational interviewing is. So we're going to talk about just quickly what it is and then how it as an evidence-based practice travels well across cultures. And then I want to get a little deep and think about why it works so well with people, with all people. Why motivational interviewing works so well, and identify some of the elements of this complex style of communication that support its adaptability. Slide. So here's just a little bit about the cross-cultural transferability of motivational interviewing. The premise has always been, before we even had good research, the premise has always been that motivational interviewing is inherently transferable. But there's some evidence to support some examples where motivational interviewing was used successfully to lead people out of a place where they were reluctant to change their behaviors to a place of action in situations that weren't just in multiple situations, right? That's what I want to say. So what these slides don't, hang on one second. Sorry. I've got weird notes. All right. Hang on, sorry, I'm getting all messed up. Okay, so this is just an example of some places where motivational interviewing was used. Safe water practices in a Zambian village, increasing the fruit and vegetable intake through African American churches, encouraging HIV testing among Native Americans, and smoking cessations for parents of sick children in Hong Kong. From the start, we knew, and that's what I was starting to say, that we knew that motivational interviewing would work well no matter who you were using it with. As a matter of fact, in one of the very first meta-analyses of motivational interviewing, Jenny Hedema, and just from 2005, saw that the effect size of motivational interviewing with African-American women in a particular trial was double the effect size. It was double. It was working better. All right, slide, please. So what is this thing called motivational interviewing that apparently works so well across cultures? the definition is that it's a collaborative conversation style for strengthening a person's own motivation and commitment to change. So let's just pull that apart a little bit. Collaborative. Collaborative means partner. It means the same. It means that I am not better than you. I don't have more information. I don't have the stuff and things that I bring to our interaction are not more worthy of what you bring. I bring expertise, I bring knowledge, I bring experience, I bring compassion and a passion for helping people. That's what I bring. But the person whom I'm working with brings expertise on themselves. They know themselves better than literally anybody else. And so those things aren't hierarchical, they're collaborative. And so we do all kinds of things. And I'll tell you a few of those things to make sure that we're not creating any sort of hierarchy in our relationships. And what I'm trying to, and then it's a conversation style. And the fact that it's a conversation style means this looks like a smooth flowing conversation between two equal partners. This isn't a trick. It isn't a technique. It's not a gimmick. It's not a way to trick people into doing things they otherwise don't want to do. It is a conversation between two equal partners. And then it says that it's for strengthening a person's own motivation. If I am strengthening your motivation, I am believing that you have motivation. When you go to a gym, when you go to a personal trainer at a gym, they never say to you as you walk in the door, hey, grab a bicep there out of that basket by the door. We'll use one of the borrowed biceps here that we have at this gym today. They never say anything like that. Would be crazy, right? They don't say that. They know that even though your bicep may not be right where you want it and exactly how you want it, you have one, and they're going to help you strengthen it. We have to believe that same thing about people's motivation, that they have it, It just needs strengthening. And then once we strengthen it, we can help them move out of that place of indecision into a place where they're committed to changing. Slide. So what I see in practice, what I see when I begin working with people is I see a lot of here's what you should do. And what I want them to be thinking is, what do you think about this? I see a lot of here's why you should do this instead of what about this change appeals to you? I hear some, come on, it's going to be so much better. Just make this change instead of what would be better in your life? What would you avoid? What would get better? Or, oh gosh, you don't want to live like this, instead of you get to choose how you live. Slide. Here's Hagar. Turns out that Hagar, this is what I see in practice. It's very, very hard to not fix people. And this is Hagar's doctor. He says, you look tired, Hagar. I am. I spent most of the day in my doctor's waiting room. Dr. Zook said I have to make big changes in my diet. To begin with, he said I have to switch from beer to water. Then he said I have to switch from fatty foods to cooked vegetables and fresh salads. Fast Eddie says, wow, what did you do? He says, I switched doctors. Hagar is saying that. What is he saying? What is he doing as he's saying I switched doctors? He's having a beer, isn't he? Because what the doctor did, instead of thinking he was fixing him, which is what his intention was, I'm going to fix you. I need to fix you. What he did is he got Hagar more defensive. And when people get more defensive, and when they're looking at people from a deficit worldview, then people just do more of the very behavior we're trying to get them to stop. Slide. So this deficit worldview, when we look at people like this, this is what we think. This is what we're doing. When we're treating people like Hagar's doctor, it's as though we say, you're an empty head and I have what you need. And when we push people like that, we get what we ask for. We're going to get a person who's defending their behavior rather than being in an accepting space where they can consider what they want to do or not do. And so rather than pathologizing people's reluctance to change, or better yet, accept that our insistence in telling people what they ought to do is partly responsible for the reluctance or flat out defensiveness. That's what we need to do. What happens when we do that is we inadvertently strengthen the wrong side of the argument. Instead, if we look at people's reluctance to change as expected or accepted, then that's when the magic can happen. So on the next slide, what you see is the competence worldview. And that's a switch from the deficit worldview. When we look at people, all people, as competent, we're saying you're competent. You have your own knowledge. You have your own attitudes. You have your own capabilities. My role is to evoke and guide this competence. You have what you need. Together, we'll find it. Because what we believe in motivational interviewing is that people possess substantial personal expertise and wisdom regarding themselves and tend to develop in a positive direction when they're given the proper conditions and support. When you look at motivational interviewing like this, you see that rather than installing expertise, barfing our expertise all over people, we're instead part of their proper conditions and support so that they can want to change, they can change, they need to change, they have their own reasons to change. Our way of guiding, our style of helping is what helps people go from indecision to committed change. Slide. So we have to regard ambivalence not as something, not to pathologize it, not to think it's weird, not to guard against it or argue people out of being stuck. We have to look at their ambivalence as normal, natural and normal so that we can support the side of their argument that supports change, right? If we're constantly just battling against the, I don't want to, I don't think I can, not today, it's really hard, all we do is we get them more and more defensive. And then we do what we've always done. Next slide. So there are some things that we do in motivational interviewing to honor the fact that we see ambivalence as normal. One is we take a long, hard look at how I view myself as the helper and how I view you as the person who needs help. That's the spirit of motivational interviewing. And then we make that come alive through various tasks. There are things that we focus on doing. We engage, we figure out who you are. We focus, we figure out what we're talking about. We talk about why you might want to do something about it. That's evoking. And then we plan, and that's the how. The words that you use to follow, my daughter's home for the weekend, apparently. She's just talking away in the other room, sorry. The words that you use follow a mnemonic, which is ORS. And we use open questions, affirmations, reflections, and summaries. So I want to just touch a little bit on the spirit and give you an opportunity to consider how it fits into your ideas of cultural responsiveness from your perspective. So partnership is looking at, I already said this, looking at the person as an equal partner, a dance partner. That's metaphoric. Don't actually dance with clients. We get in trouble when we do that, right? So it's metaphorically like meeting you where you're at. Next slide. Oh, sorry, go to partnership. You can skip ahead now, Gabriella, sorry. And then the next element of spirit I want to touch on is acceptance. And acceptance is multifaceted. Acceptance is absolute worth. No matter who you are and what you've done, you are deserving of my help. I'm going to look to affirm you. What are your strengths? What are your values? What's important to you? What efforts have you put forward? What characteristics of successful changers do you possess? Maybe you haven't been using them towards making change, but you've been using them, you possess them. And I'm going to point those out to you. I'm going to describe them for you rather than evaluate you and cheerlead you. That's not helpful. I'm going to be especially accurate in my expressions of empathy. And then I'm going to talk about autonomy. I'm not going to be afraid to say, and ultimately what happens here is your choice. And that is so scary. It's so scary for mental health and substance use disorder providers. It's so scary. Next slide. And then skip this one and go to the empathy slide, please. Thank you. So just to be clear about empathy, it is really important that we're on the same page about empathy. Empathy is a very important ingredient in motivational interviewing. And we want to be clear that we're not being overly empathic, that we're not trying on people's feelings. That's going to burn us out. And we're not just having it up in our head in kind of a kind of way. That's not good enough either. What we really need to do is we need to listen to people, offer our reflections of what they're saying from their perspective. We're holding up a mirror, but it's not my own perspective on you. Even if two people often think that empathy comes from having had the same experience or problem, that they're going to join with this person because they have the same experience. That's especially disrespectful in a culturally responsive realm. And so even if two people have very similar experiences, their experiences of those life circumstances are likely to have something that's unique for each of them. So me assuming that I know because I went through something the same and that you have the same thing, what that does in me as the helper is it shuts down my curiosity, and I'm not going to be very good at empathy. I have to be curious in order to be empathic. It's disengaging to think that you automatically know another person because of some characteristic or something you share or something you've assumed about them, period. Next slide. Compassion. Compassion is just alleviating the suffering of other people. You're doing that by coming to this workshop, right? Even thinking about changing the way that you communicate with people is compassionate. Finally, evocation. Evocation is about being curious. I don't know what your dials and levers of change are. Oh, you can go to the next slide. Sorry. I don't know what your dials and levers of change are. I need to get curious. I'm going to listen to you. I'm going to reflect. I'm going to ask open questions. I'm going to ask fewer questions overall. I'm really going to just listen and do a lot of reflecting. So those are the elements of spirit. Go to the next slide. So I want you to think about how the elements of spirit, how you might have been the recipient of one of these elements of spirit. Who surprised you by being a partner, treating you like a partner? Who communicated a deep acceptance of you just as you are? Have you experienced compassion in your life? Someone who was concerned for you, committed to your well-being. Maybe you've been the recipient of evocation, somebody who really knew how to bring out the best in you, who saw your strengths and your talents that you didn't even know you had. So as you think about this, you can go to the next one, Gabrielle, and get ready to participate in a poll. And I think, Gabrielle, you can put the question up. So which element of the spirit, partnership, acceptance, compassion, evocation, which one have you received from another person in your own life? Just sit in what that felt like for just a moment. Look at all that compassion, partnership and compassion, acceptance. Pretty powerful stuff. As people are answering, we can just keep going a little bit here. I'm almost done. I'm going to pass the baton. So there are some key skills in motivational interviewing, key skills that we have to learn how to think with our head and our heart and our gut, adopt these spirit principles. And then there's ways that we make those things come alive. And the way we make those things come alive is by doing these skills, the skills of listening, learning how to listen. Many practitioners need to relearn how to listen, how to ask open questions, what the purpose of an open question is, how to get out of assessment mode, thinking if I find out all the information about you, I can fix you. Like really being genuinely curious about the right things, the things that move people in the direction of change, using affirmations versus compliments or cheerleading, reflecting, genuinely reflecting what people really need you to reflect. They need you to reflect their lean in the direction of change. They need you to help them look for little tiny elements in what they're saying that lean in the direction of change, being empathic to their stuck, but at the same time helping them see hope, holding out hope for people. And our summarizations help people get organized. All right. And then, Gabrielle, if you can just skip down to slide seeking collaboration. Thank you. One more. Oh, there we go. Oh. Well, this is fine. Actually, this is a good one. We'll pause here for a second. In order to fully embrace, I keep saying this, but this is just, the big guy says this too, right? Carl Rogers was really into listening. And I've said listening is important a number of times. And what Carl Rogers said is, we think we listen, but rarely do we listen with real understanding and true empathy. Yet listening of this very special kind is one of the most potent forces of change that I know. So at the heart of everything is listening, just listening to other people. Slide. And slide again. We already talked about the OR skills. And then just a couple of things. There's the seeking collaboration, which is where you ask the person, do you want my information? Do you want to talk about this? That's also a big thing that we do in motivational interviewing. And then here, finally, emphasizing autonomy, being willing to say to the other person, it's your choice. Yeah. So lots and lots of stuff, lots of knowledge to learn in the practice of motivational interviewing, and lots of skills to practice. And when you get to fidelity with the model, you can use it. You can use it in a adaptable, flexible way to really, truly meet people where they're at. There's lots of places where you can get some more information about this, and they'll be shared with you at the end of this presentation. So I thank you for letting me blah about motivational interviewing. It's one of my passions. I love being able to talk about motivational interviewing. And what I'm going to do is I'm going to hand the baton to someone else who likes to talk about motivational interviewing. And Dr. Henry is going to share some of his experiences with motivational interviewing with us. So thank you.
Thank you, Laura.
Thank you.
That was good. That was a lot in a little small space. When I went to graduate school, I took a course on doing therapy, and my instructor ended up hiring me. And when he hired me, I was assigned to work for this agency in the county at a Catholic parish. So I go in the evening and I see clients, and people would come in with two-parent families, white, middle class, and I'd come in and I'd do therapy for 4 or 5 hours. I give them home assignments. They do the home assignments. They were open to the interaction, and I felt like super therapist. I felt like everything was going well. Then I started working downtown also, in the inner city in Baltimore. And things changed real quickly, because I found out that the people in the county, in the parish I was working in, were working out of a different worldview than the people downtown. The people downtown were generally Black, lower income, and were not necessarily open to systems coming in, did not really trust systems. And even though I didn't consider myself part of the system, they saw me as representing the system. So they didn't care how many degrees I had, where I went to school, what my experience was being a therapist. They were looking for a more relational evaluation of who I was. Did I seem to really care? Did I seem to be competent? Was I genuine, or was I present? So they were kind of assessing me by what's considered a more relational worldview than my other clients, who were assessing me from a more, what's called a more linear or worldview, a more linear worldview. Later in my career, as I continued to work, and we started even developing some models that we saw as being culturally relevant to different populations, I was really impressed when I found out about motivational interviewing, because it was so consistent with what we were getting from our interactions on the ground in the neighborhoods every day, every day. It was more about how to do than what to do. Laura talked about this thing of problem solving. You know, I teach nurses and nurse practitioners and such, and they all the time, they talk about how they're trained to solve problems, and they'll come in with that mindset. But when we start talking about motivational interviewing, things shift, because you're not there to solve somebody else's problem. You're there to assist them as they go on their journey of problem solving. Laura mentioned it's a person-centered way of interacting with people. It's a communication style. And as Rogers would probably say, and when we talk about communication, the main thing we have to do is listen. And it's easier said than done. When it does happen, it gets our attention. Excuse my language, but that's how we hook up a lot of times. We're talking with somebody and they start really listening to us. They get us and start letting us know. And next thing we want more relationship with that person, because they are genuinely listening to us. So when I started hearing about this motivational interviewing, I started realizing that it was more than just a technique, more than a model. It's a way of being in the world, a way of being. Because it has certain assumptions that respect everybody's right to be who they are, and to adjust to and adapt to the world in ways that are characteristic of their specific culture. And when I say their specific culture, I'm gonna take a little step further. I say each one of us is a culture unto ourselves. Think about it. We may be male or female. We may be Black or white. We might be mental health professionals. We might be have graduate degrees. We might like baseball. We might like tennis. We might be from a two-parent family, a blended family. All those things make each one of us have a unique culture, a unique culture. Mm-hmm. And that means whatever interaction is going to be relevant to the most people has to be adaptable, and it has to be about more about how than what. Part of what's happening in our society, as I see it, is we are really caught up in this outcome things. Excuse my language, but I think it comes from the financing from the top or whatever. But the outcomes say that, when we have to work, we have to do certain things in a certain amount of time in order to be successful. And, that probably has its place. Mm-hmm. But what I found out early in my career is a lot of times when I interacted with clients and we had a real good interaction, sometimes we didn't meet those outcomes. I can remember several situations. One where 2 years after the client went to jail, I'm on the tennis court and he comes and gets me off the tennis court when he sees me, and he just tells me how pleased he was with what he learned from me. I said, excuse me, but you went to jail. He said, oh no, you don't understand. I was going to jail way before I met you, and you need skills in jail. I said, oh, he was teaching me. Another client I ran to he kind of running behind the car, and he stopped my car. And I said, he came up and started talking, and I didn't recognize the voice because in the 6 months I saw him as a teenager, I never heard his voice. He was quiet. I couldn't get him to really talk. And he started talking to me about what he learned from me and what he was transferring now to his infant son, some of those same skills. My point is this: when you have a healthy process, good is going to come out of it. It may not come out in the time that you want. It may not come out in the way that you want, but good is going to come out of it. What I love about motivational interviewing that it has that are relevant to us all, no matter what culture we are from or influenced by. And some of those assumptions. One is that all people want to be healthy and happy. Now I've certainly met folks, and I'm sure you have, who didn't know how to be happy, didn't think they could, but I've never met anybody who didn't want to be happy and healthy. As Laura said, all people have motivation for change. Maybe not to change the way I want them to change, but they have motivation for change. One of the things this model requires, and Laura kind of hinted on this on the end, it requires that us as providers, that we be open, curious, and available in enough different way. You can't not be present and do this, because you'll be bringing your stuff to the table, pushing it on the client. To really do these attitudes and skills properly, you really have to be working on yourself. You really have to know how to listen, how to be present and open to someone else's way of seeing the world and processing their experience. Again, the ambivalence piece. Ambivalence about change is natural. We all are ambivalent. Right now, those of you who might be married, you know, you may have met the person of your dreams, you know, that you've been dreaming about since you were 5 years old, and that person was ready to get married with you. And 99% of you said, yes, this is the person, this is what I want to do. But there's going to be a little bit of ambivalence back there. It's going to say, do I really want to give up my freedom? Can I really do this? What will this cost me? That's just natural. That's just natural. And ambivalence at its extreme can be resistance. And mental health is the only field where we see where resistance becomes a negative thing. If somebody tells you today, if your doctor tells you today you are resistant to cancer or tuberculosis or COVID, you feel good. But when we see a client as being resistant, we think there's something wrong. But resistance is a way an organism attempts to take care of itself. The way it attempts to set boundaries, has filters, and to make decisions about what it will engage in and what it won't, for its own welfare. So it's really a healthy thing. And again, according to Miller and Rolnick, and Laura just said it again, when we meet resistance, what do? We go to reflecting. We go to an active listening stance to hear and understand from that person's perspective why they may not be accepting or open to the idea that comes, because that will tell you what they are open to. That will tell you what will work for them. And in the process, another piece that I love about this is the unspoken assumption is that we all have free will. We all have free will. I've met clients in younger days when the judge say, either you do this or you go to jail. And the client say, oh, well, I'll go to jail. I know how to do jail. All my buddies down there anyhow, I'll just go to jail. What the client was saying was, I make my decisions, not the judge, about what I'm going to do. And as a human, sometimes that's the only thing we get. We can't determine our circumstance, but we always have free will to determine how we're going to respond to our circumstance. again, this model represents to me a way of being. It accepts that change is a natural process. We've all heard the saying, the one constant is change. The only issue is how we deal with change. Matter of fact, my definition of intelligence is one's ability to adapt and adjust to an ever-changing environment. What may have been an intelligent move last year may not be one this year, and so forth. We are constantly required to adapt and adjust. And I think pandemics just bring out more of that, but that's always an issue. The assumption that probably touches me most is the assumption that everyone has what they need inside of themselves. Everyone has what they need inside of themselves. So it's not my job to come up with a solution for them. It's not my job to give them new stuff. It's my job to help them explore what's already inside of them in their effort to move forward in their lives, because everybody has what they need. Now think about that. If we apply that as a society all over the world, how different would interactions be? When we can see a person as having worth, having value, having competence, and our job is just to assist them in tapping into, sometimes interpreting what they already have. Because a lot of times what beats people up is their interaction with this larger society that is not so much accepting, particularly when there's not conformity. And this model works so well with, talk about Carl Rogers' work, with Maslow's work. Maslow's talking about hierarchy of needs. We all basically have the same needs, from physiological needs and safety, love and belonging, esteem, and actualization. And says, generally people are not willing to work on the higher level needs if their basic needs aren't being taken care of. And we have to listen to them in a deep and curious way to really find out how they perceive their needs as being met or not met. So this is a model that I see, although there's been a lot of evidence that has supported it, and that's a good thing. I'm not particularly real big on evidence-based practice. Don't tell nobody. Don't tell nobody. Because it's a science, it's art, and it's economics. You can do some research in southern Iowa with people who are left-handed and who were born on Thursdays, and then want to apply it that same way to everybody in the world. Whatever model you have, it has to be adapted to the people that you are practicing it with. This model, and so many models that I see as really culturally applicable and consistent with the class standards, are bottom-up models. What we call practice-based evidence. What I learned when I was going into the project and meeting with people and was getting there, listening to their stories, feeling their attitudes, getting their interpretation of what their needs were. That is practice-based evidence. That comes out of a more subjective worldview. Objectivity is one way to know things, and it has its place. But what also is a part of the major worldviews that many people have, this relational worldview, is about subjectivity, believing what you experience. There's some things that you cannot know objectively. For instance, if if you talk about spirituality and whether there's a creator or whatever, you know, that's not something that you can reproduce at will, show to others in a way that makes it empirically validated. But that doesn't mean you don't have the experience to say it's real. You know? And that must be attended to. Part of my point is so much of what we deal with in this society comes out of that linear worldview that is based on materialism, objectivity, outcomes, facts, as such. And, it has its place, but that's not the only way to see the world. And many of the cultures and subcultures we deal with are more relational oriented. So again, look at the world more subjectively. The whole concept of, what's the I forget the term now, but it says there's no such thing as facts. There's only social agreements, I live in Baltimore. Is that a fact or is that a social agreement? Well, we may consider it a fact today, but it hasn't always been called Baltimore. We don't know if it's going to be called Baltimore 10 years from now. That's a social agreement. The green stuff in your pocket with dead presidents on it, is that a fact or social agreement? Well, according to Wall Street, the value of that changes. That's a social agreement. All I'm saying is there's more than one way to see the world. And there are many cultures that look at the world in a more relational way. Again, where it's not the outcome that's important, but it's the process. This model is more about how than what. This model is more about how than what. It says, when they first started talking about the spirit of MI, it really got my attention. This is the first time I had ever heard a clinical model talk about spirit. Spirit refers to me to energy, to vibration, to the connection between people. And this model focuses on that as a primary vehicle of healing, the spirit of MI. And again, it's not something you can fake. It's something each one of us has to live in order to do. Because you can't, you can't take somebody somewhere you haven't been. You can't, in a genuine way, introduce them to something that you're not using yourself. Because again, relationally oriented people are not as concerned about the cognitive, what it looks like on paper. They're concerned more about the affective, how it feels. If it does not feel genuine, if it does not feel concerned, if it does not feel competent, then you get less access. You get less access. So motivational interviewing, as I see it, is a prime model for moving across cultures, because again, the main skill you use is listening. And when they talk about listening, there's a nomenclature that's used in motivational interviewing for listening, for active or reflective listening. But there's other ones that come out of structural family therapy and other places. But there are a set of skills that come with listening, as well as attitude, and learning how to be still. If your mind is racing all the time, you're thinking about what's for dinner, or how much money you don't have, or what you need while you're sitting with the person, then it's going to be a little difficult for you to really actualize what's intended through motivational interviewing. But if you are working on you, learning how to still be present, to listen inside of you, it's going to make it easier to listen to other people in a genuine and helpful way. So it's not about fixing people, it's about assisting people, assisting people. I had the privilege of working for about 10 years with Carlo Di Clemente, who was one of the founders of the, what was it, Stages of Change, Stages of Change. And I'd worked with him about 5 years before I realized, heard about this thing about pre-contemplators, you know, different kinds of attitudes that people have when they say, I'm not ready to change, like that. Mm-hmm. And and these two models, according to Miller and Rolnick, you know, also, these two models work so well together because they say, if we can figure out where that person is in relationship to what's being offered, then we can be appropriate in how we respond to them, appropriate, supportive, and encouraging, like that. And again, Laura said, if you get a pre-contemplated that's a rebellious pre-contemplated, you want to make sure that you say in sometime in the process, you want to say, oh, but it's up to you. But it's up to you, you know, because that's, you know, if they're one who is resigned with less energy, then you have to instill hope. You know, different ones require different approaches. So it's about learning the nomenclature, the techniques, the skills, but then applying them in a genuine and real way, acknowledging that the person has what they need and we're just partnering, collaborating with them to evoke from them what is best for them, according to them. Okay. I don't know if that was 15 minutes or if that was 20 minutes, but okay, we'll stop there and take some questions.
Great. Thank you so much, both of you. This has been fantastic. This is Christina here, one of the co-chairs of our group, and helped have the pleasure of working with all of you to get these set up. That was fantastic material. And as long as I've done and heard about MI, these are the things that I always think about. So I really appreciate all your really helpful points, given that this is just a taste of what we can dive into. We do have a few questions. The first one is there a good way of using MI with someone who is in the grieving process, especially if they have recently experienced a significant traumatic loss? So I'll let either or both of you answer that.
Well, I'll say the first thing you want to do is reflect the feelings, acknowledge the feelings. You know, again, in our society, we tend to run from feelings, but the feelings always catch up with us, and then we end up acting them out in some way. So if you can help a person to process the feelings that are already there, to identify them, which Daniel Siegel says that if you can name it, you can tame it. You know, doesn't mean you're not going to have some discomfort. That doesn't mean you're not going to be sad, but all feelings are messengers. Feelings are messengers, and as such, they come with messages and lessons. So the more we're in touch with them, the more we're informed, guided, we're taken care of through the process. And with loss always comes a couple issues. One is that whenever we lose something, we're giving something in return. And loss always requires us to reassess our identity. I mean, my mother passed, you know, I said, who am I without her? I mean, my wife passed, you know, you have to reassess yourself. So you help people by helping them to process their feelings about what is going on in their life, what it means to them, because it means something different to everyone. Of course, giving them as much support, time as they need, because there's no time limits on it.
Yeah.
Great.
Yeah, and I can just add a little bit, piggybacking on that. I think it's also important to, and Dr. Henry was talking about this, that there are things that we do in motivational interviewing that are just excellent relational skills. And Dr. Henry was talking about how important, how some cultures, well, everybody really just wants relational stuff, right? Like we all just want to have people understand us. And so learning like the OR skills and seeking collaboration and emphasizing autonomy, those are all skills. And those can be used no matter what style of communication you're using. Those are really good skills. Motivational interviewing per se is for the resolution of ambivalence. So if the person who's grieving isn't ambivalent about changing like sometimes people are ambivalent about moving out of the grieving process, then motivational interviewing you can pull into the motivational interviewing lane and effectively use it. If there's not ambivalence, then it's about using something else and still thinking about all of these good relational skills that learning motivational interviewing can help you bolster. Absolutely. But you're not really trying to use the technical parts. Yeah.
Great, thank you so much. I want to make sure we have a couple of other polls, so I'm going to go ahead and turn it back over for our team to share. There's a couple of open-ended polls, and I'm going to skip ahead to that. And just a reminder, the link should help you be able to type in your answer, and if not, you can put it in the chat if need be. All right, let's go ahead and get to that poll. So what do you like most about this particular practice of motivational interviewing? I don't know if either of you have any comments, but it's always really interesting to see what people appreciate about MI. And I think when we feel in that flow and it's working, it feels really great, and it's getting to these things that people are naming. It's not every day, it's not every time, but you know, when it works, you can feel it. And just a reminder, we are capturing all these polls. So even if we move on to other slides, we'll be able to capture your comments here. Maybe while people, if folks are still answering the poll, or maybe we're kind of done answering those. Okay, perfect. Okay. We have another poll about what barriers might be in place or sort of challenges for, or no, I'm sorry, what would be a reason to start using this practice into your work? And then we'll talk about barriers, and then we'll get to our last couple questions. So what's the reason for you to start utilizing this as a practice in your work? Appreciate folks for having technical challenges. There's always some that don't work out, but appreciate folks putting stuff in the chat as well. We have a couple questions I'll get to in a minute, but while these are rolling in, I guess a related question that just came in is, what are some strategies to begin? So if you are trying to enter into this space and use some of the spirit and skills of MI. Question is sort of, what are some basic techniques to begin the MI process? And I know for me personally, when I teach or talk about MI, ORS is always, the easy thing to go to, and reflective listening. But if either of you want to speak to that, how do people just get started, or what are sort of the minimum steps to weave this into your work?
Well, certainly the ORS, as you say, is a good place to start. Just learning those basic skills. Again, my experience is they don't just help with clients, they help with family members and friends and everybody. So often when we have disagreements, it's about misunderstanding. We miss each other, or everybody's trying to be right. Some of us would rather be right than happy. So we're not listening and communicating. We're just trying to get our point across. So the ORs, just learning them is an excellent place to start. It's an excellent foundation. And if you do them, that's going to even take you deep into the spirit. The next step that I really like is change talk. Learning to listen for and elicit change talk. So we always understanding that we're listening for what's the acronym, Laura?
Darn cat.
Huh?
Darn cat.
Darn cat. Desire, ability, reason, need, and commitment. We're always listening for anything that implies any one of them, so we can jump right on. Somebody may say 10 things that are wrong. They say, yeah, but I know I need, drinking is not a problem to me, and this and that and the other, and and they get 10 reasons. And they say, yeah, well, sometimes it does make me a little foggy at work. Boom, they talked about need. So rather than go for those other 10 things, you say, oh, tell me more about that, about missing work. Tell me more about the struggle you've been having with that. You just listening from them what's already there. So change talk, that to me is a very powerful tool for our repertoire.
Great. I know we have one more poll. Maybe we could get to that, and then we'll finish up with a couple of other questions.
Mm-hmm.
And if I'm right, I think the next one. So this is, so we have a number of polls still, sorry. What will it take you to implement this practice into your work?
Yes. Mm-hmm.
Thank you, Christina, for darn catting them.
Oh yeah, sorry. No, I taught this a lot myself, but I will say, what I've experienced is, yeah, what people are putting in the poll there is practice, because you can talk about it, you can sit in your office, you can think about it, read a book, watch a video, but unless you are actually doing it and the person across from you says, yes, that was it, that felt good. And so I've seen staff in different places I've worked do practice groups. There are practice manuals out there, but really it's just getting out there. People hate role plays, but it's the only way to really learn it. So that's kind of echoing what I've seen. And then it's just trying to use it where you can.
Oh, you just muted yourself, Christina, but yeah, use it where you can. Yeah, absolutely. Just just practice, 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 practice. So it's about finding a place where you can learn the basics, learn enough about motivational interviewing that you can then try it in a role play situation or with the people you work with. You won't hurt them experimenting with motivational interviewing on them. You're not going to hurt them. You're not going to hurt them by reflecting. You're not going to hurt them by trying open questions. You can't hurt them. And when, as Christina just said, and when they give you positive feedback, when they're like, yes, that's right. And you start hearing more darn cat, you start hearing them leaning in the direction of change, you know that what you're doing is right. Surgeons move their practice as quickly as they do. Surgery is constantly learning new things because they get immediate feedback. We have to learn what the signs and symptoms of immediate feedback are from the people we work with. It's them engaging. It's them moving more towards change. It's them feeling heard and understood and saying, yeah, that's right. I'm going to keep talking to you. Those are our signs and symptoms of success.
And I
go ahead.
I think Gail had a piece in there. She said, try it with your toddler, something like that. But I was thinking at that moment with your children, because again, you're teaching them communication. But think about it, your 6-year-old and your 4-year-old outside in the yard playing, and then somebody runs and he hit me. Then you got a choice. You can go in there trying to solve the problem, or you can just get reflective. Oh, you hurt. You don't like what he did. Because no matter what you do, they're going to be back out there playing again in 5 minutes. If you show them that you have some faith in them, you're connected, you hear them, you're listening to them, they'll be better equipped. But if you just try to solve the problem for them, that's not necessarily going to teach them how to solve the problem.
Mm-hmm. No, thank you. Well, and in my experience, it's also when it's not appropriate to use it. So if something's literally on fire, and how do you feel about that? You're going to move to solve the issue. So, using MI where you can. And there's some things that we all have to do in our work that just aren't very MI spirited, but so that's great. Okay, let's move on to the next poll. But I did want to I think hopefully answered the person that asked, how to ask the right question using MI. And so some of those links hopefully will help you learn some of those skills, question guidance. It's really not about a ton of questions in my experience. So I don't know if you have advice for that, but
yeah, I totally agree, Christina. You want to, because we're trying to minimize the number of questions that you ask. Yes. I mean, the person who said, can you give us a question guide? Yeah, you want to make sure that the questions you ask really count. Because what you really, really want to be doing a lot of to show this relational aspect, to show this person that you're really working your butt off to try to understand them, to show empathy, you're doing a lot of reflecting. But you're not just reflecting every single thing they say, because every single thing they say, you don't want them to hear every single thing they say again. You want them to hear the things that they say that are holding out hope, where they have that little tiny bit, right? Like Dr. Henry said, they have 10 things are, this is terrible, this is awful, but I have been sort of thinking about this. That's right. The kind of stuff you want to learn to reflect so you can help them.
Right. So it's selective. It's selective reflecting.
Very selective.
Truly, yeah.
It's hearing it and then saying it in a really intentional, selective way. Yeah.
Mm-hmm. Remember, reflecting is not just repeating the words.
No.
Remember, feeling, just nod. You can reflect, mimic with your body. The research says excellent therapists generally are reflective 85% of the time. 85% of the time. Anything you can say in a question, you can make a statement out of, a reflective statement out of. And
with a lot of practice.
And the difference is when you ask the question, you put the other person on the defensive. They have to take a risk. But when you make a statement, you take the risk. You take the risk.
Mm-hmm. Much more questions are hierarchical. I will ask a question and you will answer it. I will ask a question and you will answer it. When you're reflecting, you're staying here. You're being much more of a partner.
Yeah. Yeah. It does take a lot of practice to not have your everything be a question. This is So I'm looking, so some questions have been answered, typed, so please do check your Q&A if you typed a question that may have been answered, but I thought this was important, and I know this relates to our being culturally responsive, and you've touched on this, but can you talk about how MI functions in non-English language speaking communities or indigenous languages, or is there any research about linguistically, culturally responsive MI, any resources? And I will share, I didn't put this in the chat yet, but we are going to have an FAQ for this session as well as a fact sheet. And so we'll list a bunch of resources. So if you share things with us later as the speakers, we can include those. But any initial responses to that?
So Gloria, just a couple things. This may or may not answer your question. There are Mint members who are training in 45 different languages. There are the MI textbook. The textbook, the latest edition of the textbook has been translated into 55 languages. I know there are members of the Mint who I've got some friends, Timpani and some other people who use motivational interviewing with indigenous populations in Australia and New Zealand. So I don't know specifically I mean, I know that they use it. I don't know where you could access any research about that, but you could certainly start by looking on the site that Christina mentioned, the motivationalinterviewing.org site. All of the latest and greatest research gets put on there constantly. So that would be the place to start looking.
Mhm.
Okay, then another question we have, someone who deals with folks experiencing sexual abuse. Do you have suggestions about MI when folks are having trouble explaining or naming their feelings? Every situation brings its own challenges, but this is a particularly difficult one. And so have you any experience or advice for when people are working in those settings or with clientele experiencing those things?
Again, I think it's about meeting people where they are. And if the person having difficulty, you might just say that. Sounds like it seems like you're having difficulty. This is really hard for you. So again, when you're reflecting, you are sometimes giving them the word. They say, no, it's not hard, but I'm angry. Oh, you're really angry about this.
Yeah. Yeah.
So it's moving with the person. It's not about coming up with the right answer, but it's about moving with the person.
Yeah. Helping them name their emotions by you doing some of the work for them. Yeah. That was frightening. That was awful. You're embarrassed. You feel shamed. You feel frustrated. You feel angry. You feel panicked. You feel whatever they're describing, helping them reflect those feelings. There's a fabulous old example of motivational interviewing where Bill Miller is talking with a nearly silent man, and he's having to help the guy, and he just is naming emotions all over the place. So because the guy's he's not doing it, but he's putting it out there. Like his energy is demonstrating what his emotions are, and Dr. Bill Miller just helps him.
My experience is nothing de-escalates a situation more than reflecting feelings, because people are acting out because they want you to understand that they're feeling something. They may not have a word for it. You can say, oh, that was upsetting. That really bothered you. Then it's starting to get in words. So it helps to calm people down when they feel like, oh, she's getting me. He's understanding what I'm talking about.
Mm-hmm. No, thank you. And, we hear this in so many different avenues, whether it's called empathy or validation, reflection. I mean, these are all the same feelings that you can express, but it's not judging. It's not having a viewpoint on it. And then that reflection, like you're saying, is not just peppering with more questions. But and I think to that point about questions, how will I know if I'm doing it right? Even if you reflected and it wasn't synonymous what that meant, they'll tell you hopefully more about why that wasn't right, and they'll tell you more about what is right. And so you'll still win. If you want to look at it that way, you're still getting some information. One last question. So I think just more of a comment, but Laura's typing an answer to you, Carlos, as well. Sort of indecision, ambivalence, certainly be anchored to fears, terrors, other thoughts. I guess one thing I wanted to chime in is people I've worked with and settings I've worked with where people maybe had some cognitive issues or weren't very sharing for whatever reason. And I think, I certainly have known that a lot of work has been done in how to adapt MI, not just with different cultural groups, but with different ways people use their language or may have challenges with language. And so it's not impossible, but yeah, it's a talking mode, and sometimes that can be challenging for people, but hopefully Laura will give you some information.